I am so excited to have this conversation with you, Gayle. Once again, congratulations on being this year's Health Hero Award. Health System Hero Award is what we are honoring you for Women's History Month. So we're just going to have a conversation, right? We're going to talk a little bit about what this work means to you, what does the theme mean to you, and then ultimately what being a member of Central Jersey Club means to you. So let's start with the first one. So in a few words, explain to me your career in community work, but not only for me, but for everyone that's going to be listening to us today.
Well, first of all, thank you so much for giving this award to our committee. It's been a very busy year, encompassing many things. This award, my career, speaking about my career, I started out really in working in community pharmacy right out of high school, and I worked as a technician, and it was a wonderful opportunity because one of the older gentlemen that went to my mother's church, the church I grew up in, he worked for the pharmacy, and he was like, "We have a young girl that's going to pharmacy school. Can she work here?" And I went down, met the pharmacist, and I wound up working there on the front end, as it was. And then as I went through college, I worked, in the pharmacy. So it was wonderful because I was able to see what it's like working for a community pharmacy. There's many different types of pharmacy, mind you. So then I went to school. I left Asbury. I graduated at Asbury Park High School. And I left and I got admitted to Philadelphia College of Pharmacy and Science.
Okay.
Which is the oldest school of pharmacy in the Western Hemisphere. We always
very nice. Alma mater. Very nice.
Yes, always have to put that plug in. And it was good. It was a fruitful 5 years, excellent education. I really can't, it was not easy. A friend of mine had asked me once, "Well, that's hard to get through, isn't it?" I'm like, yeah.
Exactly.
Say so. I mean,
pharmacy.
Yeah. It was not a cakewalk, but very learned a lot, and came back home because frankly I didn't know where to go. So I came back home. Family was still around, and I stayed in the area. It's the area that as I said, I grew up in this area. I know the people, the places, So, but I had decided in when I was in Philly that I wanted to concentrate in hospital pharmacy and not in community pharmacy, because I really felt at that time I felt that we used more of our education as pharmacists. People didn't really understand what a pharmacist did. They thought we counted pills.
Right. I mean, if you think about from a community, that's our only interaction, right? Mm-hmm. Until you are, if you're going to a clinic or you're in a hospital environment, maybe you'll get another feel for it. But that would be our only, as someone outside of medicine, I would say,
right,
would be the only function. But there's obviously so much more to that.
Yes. So I decided to specialize in hospital pharmacy, and I started working first down in Lakewood at Paul Kimball, what used to be called Paul Kimball in a hospital. Now is Monmouth South, and I worked there for a year, and then I came up to Long Branch, and I've been there ever since.
Wait, so you're in Monmouth Medical?
Yes.
You're right around the corner from me? I didn't even know that. Yeah.
Yes,
well, born and raised. So how long have you been in Long Branch?
Over 30 years now.
Wow, that's amazing.
Over 30 years.
That is amazing. So talk about, so this was so when you think about the connection between career and community, this started with a man in your church
Yes.
that kind of put you in this pharmacy space. I'm sure you had ideas of what you wanted to be or what you wanted to go into, but at that time that connection clicked for you, and you've been in this space ever since. Not many people get to have such a legacy, right?
Well, it's a funny thing. My mother was a medical technologist.
Oh, okay. All right. Okay.
And so she worked in hospital, and she worked in the private lab industry also.
Okay.
So I always saw that. I always saw a white coat when I was growing up in the house, in the laundry. There was always a lab coat in the laundry, type of thing. And even though at first I thought I was going to be, I thought I wanted to be an ocean engineer, because my father was an engineer, but he was the ship's engineer, sort of like the Scotty.
Yeah, got it.
But I didn't quite understand it.
Right.
So as I got older,
so you picked the less hard thing. I mean, those are great role models between two of your parents.
I picked what my mother would pay for.
And listen, and that works too. That works too.
Practical woman. She was like, I don't think so.
Oh, that's awesome.
She goes, whatever you want to do, but she goes, I think medicine is best for you.
Exactly. That's wow, such an influence growing up. So our theme is women providing healing, promoting hope. And we believe your work embodies that, right? 30 plus years in this space. So how would you say that you achieve that ideal in your community work and beyond?
Well, as time went on, and I would say it's definitely became quite visible to me when I went back to school and to get my doctorate in pharmacy. The angle that we approached pharmacy when we were going for a doctorate was different than how you approached it as an undergrad. I mean, you had already encompassed, you know everything on the undergrad level, and had been working it for over 20 years at that time. So when I went back for a doctorate, then I got to look at things from a different perspective, let's say. And we did a lot of work with literature, with health literature, and studies, and bedside with patients, and disease states. Whereas we focused on disease states as an undergrad, but really, really delved into them in graduate school.
Got it.
And what hit me in graduate school is that African Americans were at the top of the list on every single disease state that we studied, as far as who was most apt to get these diseases.
Wow.
And it just blew me away one day when I went to, I met with my proctor like once a week, and we would go over a different disease state. And it's funny, my proctor at the time was, because I was doing it, that clinical portion at Monmouth, I knew my proctor, he was my boss. Which he loved doing it because he used to be a professor at Rutgers, but anyhow. So I came into the office one day, and I'm about to present the disease state that we're talking about that day. And I walked into the office and I looked at him, I said, why is it that African Americans are at the top of the list for every disease I present to you? And I was a bit angry. I think he was taken a bit back by it.
Of course.
And he looks at me and he goes, well, there are many reasons. He goes, but it's true. It's true, And of course, as time went on, I realized, yes, it is true. And he was right. There are many reasons, So after I learned that, I felt that it was my obligation, having grown up in this area and the knowledge that I've acquired in my lifetime, to share some of that knowledge with my community, to, to help in whatever way I can, whomever I can. And, not to hold on and simply in the bubble of Monmouth, to get out into the community. That's really where the need was, because it wasn't there. And there are not many folks who look like us who can talk to this point.
Of course. And even today, I mean, the work lives on. So talk about this passion. And I'm seeing a theme here amongst all of our sisters that are being honored, that it was this skill, this craft, this passion, this knowledge that drove you to do more, right? One, because it affected your community and your people, but two, because you had the impetus to think, what can I do, right? Mm-hmm. I applaud you for that. I absolutely applaud you for that. That brings us back to the sisterhood. I mean, you and I have not had the opportunity to talk in this way. So not only am I impressed, but I am grateful, right? I'm so grateful that you're part of this sisterhood that we have. We think about all the different women, not just this amazing committee, right, that we're honoring for Women's History Month, but if we think about just the broader sisterhood, what has being a member of Central Jersey done for you? How has it illuminated your life?
In numerous ways. It's so wonderful being a part of an organization of strong Black women. Frankly, it's not something you see every day. Let's put it that way. And the wonderful thing about our organization is that you can bring your gifts or your knowledge to your organization, but others have other gifts and other knowledge, and you put it all together and you get this amalgamy of thought and gift, and it's wonderful. And we put it to good work.
Absolutely. Saving lives, literally. Every day.
Yes.
I have to tell you, I've been blessed by this conversation. You are our 2022 Health Systems Hero awardee, honoree. I thank you for doing what you do every day, because it could be a job, but for you, you've extended it to really impacting our community, and that has to be commended. I don't think we can thank you and your peers and those, never mind the fact of all of you that have been on the front line, literally in our society, but more so in this community. You're literally right up the street from me. In terms of medical, that is my hospital. So I can't tell you how excited I am to know that you're there, that you've been there, right? I'm just fine. But hopefully through these interviews and these messages, we will be able to drive that message home. So once again, congratulations. Thank you for taking a couple of minutes out to talk to me, as well as our sisterhood and really the world, because this thing will be blasted everywhere. And just keep absolutely being inspired. God bless you, and absolutely stay safe.
Thank you. Thank you so much. You as well.